Good morning, good morning, good morning, good morning. This is Make It Sell It. I'm Festive McGahee, and we're here live on location with the creator, Johnny Cage, of this new, all-natural, all-in-one pill, specially made for the elderly to delay the symptoms of dementia called Prefix.
Thanks, Festus. Great to be here and promote this revolutionary pill.
Tell me more about this pill.
As you know, there are over 5 million people in the US alone living with dementia. That means I can help those people with my product. I like to refer to my product as a super nutraceutical.
Why a super nutraceutical?
Because it contains, in addition to other ingredients, ginseng, vitamin B, huperzine A, omega-3, and ginkgo biloba. Asian cultures have been using some of these supplements for thousands of years, and look at them. Just look at them.
I have an Asian neighbor the same age I am, and she physically and mentally moves around like a 40-year-old. I've been having trouble recently with my short-term memory, keeping track of my purse and, So how much does your product cost? I can't wait to try it.
Glad you asked. It costs only...
Excuse me, I have to interject. I'm a pharmaceutical researcher, and I have several qualms about your product. What is your background, Johnny?
Well, I dropped out of pharmacy school during my second year after deciding that I was going to pursue an endeavor in entrepreneurship.
I do not believe that you have the right credentials to be making such claims. Many herbal supplements, which is what your product is, commonly have adverse interactions with prescription medications. Also, the 5 miracle ingredients you listed all have various levels of scientific support as to how well they actually work.
That's preposterous! I found all those ingredients by doing a quick Google search and on the internet for remedies that may help delay dementia symptoms in old people, and they were listed on pretty much every website. Some of them even had patient testimonials saying they worked all the time for them. How can you tell me that information is false?
Well, first, just because something is on the internet doesn't make it true. One thing I stress to all my patients, especially my geriatric patients, is that it is very easy to put false or misleading claims about herbal medications in the media because they are not as regulated as prescription medications. Therefore, patients need to be very careful when selecting over-the-counter medications to start taking for anything really.
This is getting really exciting. Who knew we'd have such a lively discussion this early in the morning? So, doctor, what can you tell us about these different ingredients and how they do or don't work for people?
Let's start with the first supplement Johnny mentioned, ginseng.
What's wrong with ginseng? You know it's been used for thousands of years by Asian cultures to cure all sorts of things, but in particular it's been touted to help mental capacity and memory. Plus, it comes from a natural source, the plant Pentax noto ginseng, so it has to be good for you.
Many of our medical products come from natural sources, so that doesn't immediately make it good for you. From the plant, particular components called saponins are extracted.
Saponins? How do those work?
The particular ginseng saponin, RB1, upregulates brain-derived neuropathic factor expression, inhibits tau protein phosphorylations, and reduces beta-amyloid protein concentrations. In general terms, they protect the brain by fighting off the bad proteins we believe to be strongly tied to mental issues like dementia. When other scientists did studies with ginseng in patients with Alzheimer's disease, their cognitive ability was actually shown to improve over 12 weeks.
See, it's completely safe to use, and it works.
Well, it does have a pretty good side effect profile, with some patients having fast heartbeats, stomach upset, and sleep troubles as the most severe side effects. But ginseng does interact with medications used for blood clots, particularly warfarin. So patients who are on any sort of anticoagulation therapy definitely need to talk to their physicians before taking this medication because they could be at an increased risk of bleeding.
What about the vitamin B part of the pill? Vitamins are supposed to be good for you, so why would this be bad to help my memory?
Vitamins are good for you, but it is possible to take too many vitamins. Vitamin B in normal doses, which was studied for dementia patients, is considered well tolerated and safe for most patients. However, the evidence to support vitamin B as a treatment for dementia is conflicting at best. One study found improvements in some patients with Alzheimer's disease taking vitamin B, but meta-analysis of 19 similarly conducted studies found no support for vitamin B having any effect in treating symptom progression. So while I recommend my patients to take vitamins in general, taking vitamin B to help for memory improvement is not going to do you much good.
One of the portions of the drug Johnny talked about, huperzine A, I could have sworn I just read a great article about it for dementia patients. Something about it being the future of Alzheimer's treatment?
Oh yeah! Huperzine A is a great product. It's another Chinese herbal product. It actually works like many of the currently marketed dementia medications like donepezil, galantamine, and rivastigmine. It inhibits an enzyme in the brain that breaks down acetylcholine, a neurotransmitter used in the brain to increase cognition.
Dr. McMuffin, is that true?
Surprisingly, it is. Huperzine A is being looked at in pharmaceutical companies as a new agent for Alzheimer's disease, much like Johnny said. It actually just went through a phase 1 clinical trial for treatment of Alzheimer's disease to see how safe it is for patients in past. You could see it one day in prescription medications treating all sorts of patients.
And what about omega-3 fatty acids? I know that I take those big fish oil capsules for my cholesterol. Does that mean that taking those still will improve my thinking abilities over time too?
Not quite. There is a particular omega-3 fatty acid, DHA, which is said to protect the brain tissue membranes that are destroyed as dementia progresses. Therefore, omega-3 fatty acids have a protective rather than restorative role in the progression of dementia.
So, if I take more of these fish oil pills, I'll actually be protecting my brain?
Exactly!
Not exactly. Though omega-3 acids are generally considered safe products, taking a bunch of it will cause upset stomach in most patients, and evidence to support the claims that this even works for dementia are considerably lacking. When compared to placebo groups getting omega-3 fatty acids had no significant change in cognitive abilities over the course of several studies, so I would not recommend to patients using this for dementia progression.
What about ginkgo biloba part of the pill? I've definitely read about that before and seen a lot of articles that talk about it and memory improvement. The more articles, the better.
Well, ginkgo has been studied for probably the longest time as an herbal supplement for cognitive impairment. It works as an antioxidant in the brain and inhibits beta amyloid protein aggregation, one of the hallmark signs of dementia. But the evidence goes both ways to support and deny claims.
See, there's good news and some maybe not so good news. Win-win!
No, that's not how it works. Meta-analysis that compared ginkgo at doses of 240 milligrams per day to placebo groups in dementia patients found statistically significant improvements in cognitive function, lending support to the use of ginkgo. However, a similarly conducted meta-analysis that was conducted over 5 years comparing ginkgo users to placebo was unable to find any difference in the two groups.
Well, if it works for some people and not always for some, what's the harm in giving it to everyone and hoping for the best?
Excellent question. There is an increased risk of bleeding when people take ginkgo, especially in elderly patients. And since elderly patients are the ones typically taking these supplements, it's a risk that needs to be evaluated for each patient before starting the supplement.
So give it to me straight, Doc. You think this is a terrible product, don't you?
Not so much terrible as much as, yeah, I probably wouldn't recommend it to be fair.
But some of these components sound like they would actually work.
And with that I agree. So let's recap. The huperzine A definitely has evidence to support that it works well in the treatment of dementia symptoms, since it works similar to currently marketed medications. You'll likely see this medication for dementia within the next decade or so. Ginkgo and ginseng have some evidence for working in dementia, but elderly patients definitely need to be cautious about bleeding risk when taking these meds. And the vitamin B and omega-3 really have no support for their role in dementia treatment or protection against progression. But above all, when starting any new over-the-counter supplements, you need to talk to your doctor and pharmacist to make sure they don't interact with any medications you are currently taking and are right for you. Safety comes first.
This infomercial certainly took a turn that I think no one expected. But I think we all learned a lot today about different treatments for dementia. I'd like to thank Johnny, the creator of Prefix, for trying to sell his product here today, and Dr. McMuffin for giving us a lot of valuable information.